Dental Soundbites bonus content.
Welcome back to Dental Soundbites. We are having a conversation with Dr. Barry Taylor about the impacts of cannabis on oral health. One of the things what I love about this conversation is being able to have language to use with your staff so that they don't make it weird. So it's like when you make it weird, then you don't seem as like confident. You don't seem like it's like okay, and again, I'm not advocating for it either.
Yeah.
But it's just like if the patients are coming in and they are using it, we have to be able to know how to have conversations about it, educate about it, how to navigate it in a professional manner. You know what I mean?
Yeah, fully agree.
And I think the point that the Dr. Taylor made was appropriate and very correct, actually.
Mm-hmm.
We don't feel difficult at all to discuss about tobacco and smoking, right? We are very comfortable. We discuss about this. We alert the patients about the adverse events, and this is very normal. But God forbid we enter the discussion about cannabis. Then we start losing words. We don't know how to refer to it. Is it marijuana? Is it cannabis? Weed? Is it appropriate? What should I say, right?
Right.
Another point, when I do my talk at
Yeah.
conferences and everything, I give my financial disclosure. I don't receive money from everything, blah, 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 blah. The other disclaimer that I give is around age. Now, I'm sharing this because we were just talking about 20-year-olds using it. We're talking about 55, 60-year-olds in it. And a lot of times when I'm lecturing and educating about marijuana use, cannabis use, and there's a slight distinction between the two, my attitude is much, much different with adolescents using it, just as it would be for alcohol. So, if I'm talking to a 30-year-old female who's telling me she uses edibles occasionally or uses them to get to sleep or for whatever reason, I'm just going to have a normal conversation with her. Much more for a number of different reasons. If it is a 16-year-old who is using cannabis on a frequent basis, development of the brain and everything, it's no different than alcohol. So I always give a disclaimer at the beginning of my talk saying like, hey, if I come across as casual about this, or I always want to take that middle road, but if you feel like I'm being too pro-cannabis, I want to be super, super clear. This is with an adult population. I have an incredibly different attitude when we start talking about an adolescent population.
Great distinction. Like, thank you. You even just helped me.
For sure.
With my delivery. Thank you.
Yeah. Yeah, for sure.
We do want to tell all of our listeners, if you like this episode, please share it with a friend. Then be sure to subscribe to this podcast wherever you are listening so that you can get the latest episodes.
And don't forget that you can also rate the episode, write a review, and follow us on social media.
Dental Soundbites is an American Dental Association podcast. Learn more at ada.org/podcast.